Vaccine preventable diseases. Joining me now from Cleveland, Dr. Lolita McDavid, pediatrician and child advocate at the Rainbow Babies and Children's Hospital. Doctor, thank you again for your time.
Good morning.
What are the critical questions you'd like to see from Capitol Hill today?
Well, I don't think that this is a political discussion. This is a public health discussion. And what we know is that in 2000, when we said that measles was over in the United States, we did not see the 3 to 4 million cases a year. We did not see the 48,000 people hospitalized. We did not see the 400 to 500 deaths a year. We did not see the 4,000 people with measles encephalitis. We know that this vaccine works. The vaccine we're using is the same one that we've been using since 1968. I think what's interesting is you have two states that do not allow parents to opt out: West Virginia and Mississippi. In Mississippi, they have a 99% immunization rate. They have not had a case of measles since 1992. What else do you need to know?
Well, you say it should not be political, but it may be perhaps not on a federal level, but when we talk about state-to-state laws and requirements, that does make it political. And to your point, there are states that allow parents to opt out, in some cases for philosophical reasons. In fact, a New York Democratic State Assembly person here has just introduced bill in the New York State Legislature that would allow parents to claim a philosophical exemption to state vaccination requirements. His son has autism. I do want to point out that Rob King, the Chief Science Officer for Autism Speaks, has said over the last 2 decades, extensive research has asked whether there's any link between childhood vaccines and autism. The results of this research are clear. Vaccines do not cause autism. We urge that all children be fully vaccinated. So that is why this has turned political, even on the state and local levels, because some parents are able now to have an exemption.
If you're still arguing with autism on a paper that has been totally discredited, that's like saying, well, maybe the earth is flat. I mean, we know that that's not the case. We can't keep going back and arguing about the autism. We know the efficacy of this vaccine. In a state like California, where you can opt out, they have 88 of the cases. How much more research and science do people need? If you've never seen a child with measles encephalitis, I have. I came from the generation where children did get encephalitis, and those 4,000 people a year who would get encephalitis were permanently injured. That's where the injury comes from. It's from the disease. It is not from the vaccine.
All right, Doctor, thank you so much for your time. We greatly appreciate it. Again, we'll keep our audience up to date on what's happening on Capitol Hill in this first hearing, focusing on the measles outbreak that's taking place right now. Thank you. And coming up, a U.S. Airways plane forced to make a dramatic emergency landing in Houston without its nose gear. It is one of the stories